I would like to welcome you to our webinar sponsored by FH Europe on familial hypercholesterolemia and its impact on women.
Hallo zusammen, herzlich willkommen. Alle, die heute mit uns da sind, und wenn ihr das Webinarium auf Deutsch anschauen möchtet, dann musstet ihr bitte unten in dem Menü Interpretation klicken und dann bitte Deutsch oder German auswählen. Ich wünsche euch allen eine tolle Erfahrung. Hoffentlich findet ihr das hilfreich und einen schönen Abend noch. Vielen Dank. Over to you, Sam.
Yes. So FH Europe is a group of 25 organizations from 24 countries about Europe dedicated to providing advocacy around genetic causes of high cholesterol, but also high triglycerides. Could I see the next slide, please? So our mission is related to the advancement of health, excuse me, and the prevention of early cardiovascular disease through sharing information about dyslipidemia and promotion of research into the causes of these. And the conditions we're interested in are familial hypercholesterolemia, including the homozygous form, elevated lipoprotein a, and familial, excuse me, chylomicronemia syndrome. Before we get started, we'd like to go through two introductory questions regarding the webinar. The first question, is what best describes you? And there's a number of choices. Well, it looks like we're getting a fair number of responses, and we have a broad range of groups represented today: patients, physicians, people with general interest, people from industry. That's great. Okay, why don't we move on to the second question? This looks like a very broad range of interests. I think we're going to cover a lot of these topics. So without further ado, I think we can close off this poll and I can bring on our first speaker. I'd like to, Steve Humphries, who's from the UK and has been a pioneer in using the Simon Broome registry to understand FH, is going to begin our presentations. So Steve.
So I'm the Emeritus Professor of Cardiovascular Genetics at University College in London, where I ran a research group for more than 30 years. I retired in 2015, but I'm still very active in FH and both research and very much the whole business of implementing the research findings and trying to help patients with FH being identified and therefore being given the opportunity to be treated. So here's the two questions which as a patient you should think about. Has anyone told you that you've got high blood cholesterol? And then has anyone in your close family had a heart attack at a young age? And if the answer is yes to these questions, you may have familial hypercholesterolemia, or I'll call it FH for short. So it's really inherited high cholesterol. And if you answer yes and you think you have FH, then I've got three important things for you to think about for your future health, for the health of your brothers and sisters, and for the health of your children. Now, as you all know, if you have high cholesterol, you're usually treated by being prescribed a statin medication. And so the first question to ask is, do statins work in patients with FH? Do they actually lower LDL cholesterol? And of course, as I'm sure you know, there are several different statins available, and they all reduce LDL cholesterol, some of them by 25%, some of them by up to 50% from where you started at baseline, depending on which one you're prescribed. So if you're untreated LDL cholesterol, well, let's say 5.4 millimoles per liter or over 200 milligrams per deciliter. If you take one of the high intensity statins that will lower it by 50%, you could get it down to 2.6 or just about 100 milligrams per deciliter. So that's pretty good. That's the sort of thing that you need to be thinking about. Terrific. But why do FH patients need such a high dose of statins? Well, how about diet? Diet can lower blood cholesterol by maybe 15%. So that's certainly useful, but it's not good enough if your cholesterol is really high. Since you've had inherited high cholesterol, you've had it since birth. So there's a good chance that your arteries are already a bit furred up, if you like. The atherosclerosis has already started to develop. So you really need to get blood cholesterol down quite a lot to lower your future risk. And this often needs a high dose of statin. And your doctor will usually start you on perhaps a medium dose, retest your cholesterol after a couple of months. And if it's still high, the dose of the statin or the type of the statin can be changed, can be increased. So one question that I'm often asked is, do I have to take statins all of my life? And the answer is yes, you should. Because you've had inherited high cholesterol, it's really important that you don't stop taking your statins, because almost immediately after you stop them, your blood cholesterol starts going back to where it was to begin with. But as you'll hear from Jeanine's talk and from the two patients that we have, if you're thinking of becoming pregnant or whilst you're breastfeeding, statins should not be taken. So many people say, I've heard statins cause bad side effects. I don't want to take one. Now, actually, statins are remarkably safe. Major side effects are very rare. Please don't believe what the newspapers tell you. If you think you're having side effects, tell your doctor, who can switch you to a different statin. There's all sorts of different things you can do to avoid, to deal with these side effects. Now, of course, what's really important is, will taking a statin lower your risk of heart disease? So we wanted to ask three questions. Firstly, do men and women with FH have the same risk of heart disease? Does taking a statin lower risk of heart attack in people with FH? And are men and women getting the same benefit from taking statins? And the way we looked at this was using what we call in the UK the Simon Broome FH register. Simon Broome was a man who died of an early heart attack, and his widow Kathleen set up the register in the late 1980s. So the register has over 3,000 men and women with FH. They've been followed now for almost 40 years. And when a patient dies, we're sent the death certificate, and we can see if the cause of death is cancer or an accident or heart disease. And we compare the FH death rate with the UK general population. And what we did was we compared the heart disease rate in FH patients in 3 time periods in what we call the pre-statin era, where obviously patients had their lipids lowered by diet and by an agent called resins. Then in the low statin era, when statins first came on the market, and then after 2008, when high intensity statins became available. So this is what we find in men and women in the pre-statin era. What you can see here is that women are dying for about 30% higher rate than men before statins were available. So that's the first piece of useful information. In men, when we look in the low statin period, the death rate's gone down. That's good. In the high statin period, it's gone down even more. This looks really good. So how about in women? Well, in the low statin period, we saw quite a good reduction in the heart disease, in the heart death rate. But when we looked in the high statin period, we found, to our surprise, that it appeared that the rate in women was not falling in the same way as in men. Now, what on earth is going on? We thought about this really hard. We talked to a lot of different people, and there's obviously 7 different possible reasons. Could it be that statins don't lower LDL cholesterol in women as much as in men? And the answer is Absolutely not. All the studies that have looked at this find that the statin is equally effective in men as in women. Perhaps fewer women than men are getting the high intensity or the high statin doses. We actually think this is definitely part of the problem. Studies in UK, in America, and all over Europe have shown that actually women don't seem to be being given the high dose statins. Perhaps compared to men, more women stop taking the pills that they're prescribed. And the answer is, I think there is evidence that that's the case. We don't know quite why, but that's probably part of it. Are women not living healthy lives? Possibly. I think women maybe continue smoking because they're worried about putting on weight, and smoking helps lower weight. But clearly that's bad advice. Women and men both should stop smoking because it's such a high risk. Could it be that men tell doctors about any chest pains they have and women don't tell them, or they get atypical pains? I think this is probably part of what's going on, and Jeanine will be discussing this in more detail at the end. And I think it boils down to this. Doctors and women may think that overall women have a lower risk of heart disease than men. But as I've shown you, this is not true. So the advice to you to really look after your health is, please do tell your doctor about any chest, neck, or arm pains you may be getting, because it's a sign that atherosclerosis is building up in your heart and you need to do something about it. Please do take your tablets, and please do ask your doctor if you might need to be on a higher dose of statin according to recent guidelines. Okay, so that's the first thing you can do. Now, how about getting a genetic test? If you or your doctor think you might have FH, please consider getting a genetic test. Why is this a good idea? All country and international guidelines now recommend having a genetic test to confirm the diagnosis of FH. If it finds that you've got a genetic cause of your FH, it means you've had high cholesterol since birth. So you're at a high risk of developing early heart disease. And that means you should be considered for these high intensity lipid lowering medications. You really want to have a statin, perhaps another drug, to get your LDL really nice and low. Now, what about your brothers and sisters and children? If a test finds a genetic cause of your FH, it means that all your close relatives have a 50% chance of also having FH. They can be quickly tested and you get a yes or a no answer. If the answer is yes, children can be given healthy lifestyle advice, considered for a low dose statin when they're about 10 years old. And adults, of course, should be considered at once for lipid lowering therapy. And everyone should have a high healthy lifestyle anyway. So who in your family should be tested? Here's a family I've drawn out, and here's you. You got the FH gene, which I've shown with this red star, from your mum or your dad, who sadly may already have died from a heart attack. Now, all your brothers and sisters and your children are at 50% risk. When tested, roughly half will have, and the other half won't have inherited the FH gene. What this means, of course, is that your brother has FH, he's got the mutation, so it'd be very useful to advise him to test his children, but your youngest sister doesn't have FH, so there's no need for her children to be tested. So this is very useful advice. What can you do if some of your children have inherited the FH gene? Well, the first advice I can give you is, please don't feel guilty about it. It wasn't your fault, it was just a bit of bad luck. Your child obviously should have a healthy diet and lifestyle with good exercise, and we'll hear about that from the two mothers we'll be talking to later. But an occasional ice cream or slice of pizza is okay. Just emphasize healthy choices and help them to make those choices. Your child will be considered for a statin by the age of 8 to 10, based on how high their cholesterol is. If your relatives have had heart disease at a particularly young age, if they have other risk factors. And what is important is both boys and girls with FH should be considered equally. And now, of course, should you be concerned about your child having side effects from a statin? Studies show no evidence of risk for children taking a statin. Children almost never have muscle pain side effects, and we've shown, and others have too, children taking a statin grow through puberty at the same rate as their brothers and sisters who don't. A 25-year follow-up of Dutch FH children on statins recently published a paper and found no long-term ill effects. And of course, and as you'd expect, none had had a heart attack. Finally, what does it mean if the test doesn't find a genetic cause of FH? Because you don't have an FH gene, your future risk of heart disease is lower than a person who has an FH gene. Still, you have high blood cholesterol, so you are at higher risk of heart disease than if your blood cholesterol was low. As well as giving you advice about keeping to a healthy lifestyle, your doctor will advise you to consider taking a statin. You probably won't need to take such a high dose as someone with FH, but again, your doctor will probably check how well you're responding. Finally, because you don't have an FH gene, your doctor won't offer a DNA test to your relatives, but of course it might be useful for them to get their cholesterol checked. So finally, please remember that the best person to look after your health and the health of your family is you. And we are here with your doctor and with other patients and support groups in your country and in FH Europe to help you look after your health. Thanks very much. I'll stop there.
Thank you so much, Steve, for a very informative presentation. I would like to now introduce Karolin Kastowsky, who will be giving our first patient presentation of what it's like to be a woman living with FH. Karolin?
Hello, everyone. I welcome you to this webinar, and I'm very happy to have the possibility and talk a bit about my experience with FH. And I was 17 when I was diagnosed with FH. I think I was very lucky. My practitioner, he sent me to the hospital with extreme levels for my age, and this was where I met Professor Witthelm, whom a lot of you might already had heard of or have met with. And unfortunately, my father, and he had a very high cholesterol level, so it descended from his side. In fact, the whole family got tested, sisters and nephews, and they all had a bit of a significant cholesterol level as well. So we got to the AKH, and the first thing Professor Witthelm told my father was, this is very serious. And if you don't change your lifestyle, this might cost you your life. And my father, he died 3 years later on a heart attack. And he left a big hole in the family because he didn't look after himself. And I don't know when exactly, but I decided then I never want to follow in this kind of footsteps. I put on other shoes from him, but not those. At the beginning, it was difficult for me to accept that only medication will help me to maintain a healthy lifestyle, and this was that medication will always be part of my life. But having lost one parent, I simply learned how to cope with this issue. I was always a very sportive person, but I knew that this will guide me through my life, like for the rest of my life. And I'm still trying to keep up my training like 4 to 5 times a week and move every day. Also my diet, my 50% of healthy diet, Steve. I was sent from a very early age to a practitioner from Professor Witthelm. So when I was 17, and I was a bit struck at the beginning because I was like, why would I need to change my diet? I'm thin, I'm very sportive. I mean, look at me and look at the other kids here. They're like half my age and double my weight. But there are so many things that you still can do with a healthy diet and a healthy lifestyle. So it's always about those little steps and those little changes that can really change the outcome of your life. I actually read a lot about a healthy lifestyle and healthy diet, and I collected so many insights, and I always love to cook. So over the years, I started to create my own way and ideas of healthy kitchen mix. So I started a food blog on Instagram some time ago, where I regularly post my recipes that to motivate other people and to make them see that a low cholesterol diet is anything but boring. My life is, or it feels as normal as anyone's, and I don't feel ill at all. But only because I think I've accepted that I have FH and I know about my issues. I need to take care of them. So I think I'm a very lucky person because I was diagnosed quite early, and I was lucky to meet a specialist at a very early age. I got through 3 pregnancies. All my kids got tested and they're all negative. My kind of disorder is something well known and treatable. So I think no one has to be afraid of it. I got the right people. I got to know the right people from the beginning. So with Professor Wittheim, who taught me how not to listen to anyone who says FH is not an issue for kids or women, or that FH is just an issue when you're getting older. I love cooking, and there is a lot you can do to stay healthy and fit. There is a lot you can do to maintain normal levels of cholesterol, and there is even more you can do to live a happy and full life. I have no arteriosclerosis, so everything is very clean and healthy. Fingers crossed. Only my knowledge about FH can help me maintain a healthy life. And I think it's not only my knowledge, but also the knowledge of the medical stuff as well, which varies in huge ways. I have no idea how many different medical opinions I have heard over the past 25 years about FH and my treatment. I really should have collected those. And another good thing is I just learned from Steve, my gene defect comes from Norway. And so probably I descend from a Viking. So an ill Viking, but still, how cool is that? I wanted to quote something really wise in the end to give something to think of, but I found this one instead, and I think it sums my life up. It's from Eleanor Roosevelt, and she said, "Women are like tea bags. We don't know our true strength until we are in hot water." So I know this issue made me stronger and the person I am today, who I am today, because it's a constant companion. But I think it's up to me to decide if I want to be afraid of this companion or if I accept it with all its flaws and live with it. So thank you, and I hope anyone who listen and might have FH and is a bit uncertain, please get in contact with FH Europe or your FH in your country, because it really, really helps, and it helps to know about it. Thank you.
Thank you so much, Karolin, for sharing your story. I would like now to introduce Michelle Watts from the United States, who not only has lived with FH, but has a daughter who has the homozygous form of FH, homozygous FH. So Michelle.
Hi, everyone. I'm hoping you can hear me. I'm having, unfortunately, a little technical difficulties on my end. Thank you for being here today. I'm very honored to be here today from the USA, as Sam said. I'll just get right to it. When I was 18, I went to my practitioner for a physical, and he did some blood work as part of the physical, and my cholesterol level came back very high. I was not told I had familial hypercholesterolemia. I was told I had high cholesterol, and it was apparent to me that my cholesterol was from my diet, as he also sent me to a nutritionist and instructed me to exercise even more than I already was, and to just be healthier. There was no talk of statins, no talk of it possibly being a genetic disease. It was just, your cholesterol is too high, you need to change your diet, exercise more, go on with your life. So I did. Some years later, I had a new doctor, and that doctor finally did put me on a statin medication. But unfortunately, I didn't understand the importance or the severity of FH. So I took my medication sometimes and sometimes I didn't. I was in my early 20s. I thought I was invincible. Go on a few more years and I was married and we were starting a family. My obstetrician at that time informed me that I needed to stop taking any statin medications because of my history of high cholesterol. And I was told over and over again throughout my childbearing years that if there's any chance of you becoming pregnant, you know, I would not want to be on any statin medications. So I had that drilled into me over and over again. So for, I would say, a lot of my 20s and probably most of my 30s, I was on no statin medications. Fast forward a little more, and I'm now the mom of 3 beautiful children. About 6 years ago, we went to my children's, I had 2 of my children with me. We took them to the doctor for their well child check. Now, all through the years, every time we've gone to their doctors, we've had to fill out a survey that asked, is there a history of early cardiac history in the family? Yes. Is there a history of high cholesterol in the family? Yes. However, that was the end of it. There was never any discussion about why they were asking these questions. And there was never any discussion about testing my children. So about 6 years ago, I asked our practitioner to do a lipid profile on my 2 children that I had at the appointment. Unfortunately, my son's cholesterol, my oldest son's cholesterol came back over 300, and my daughter's cholesterol came back over 800. So we were immediately told to go have my daughter's cholesterol rechecked because they couldn't believe her cholesterol was so high. We went back and had it checked again the next day, and it was even higher. So we were immediately sent to a doctor at a hospital about an hour and a half from us. Unfortunately, it wasn't the best experience. We were told that Avery, my daughter's name is Avery, I'm sorry. We were told that she had homozygous FH. This was about the first time we had ever heard of familial hypercholesterolemia and really understood that it was genetic. This doctor also instructed us that Avery would need to be on statin medication and probably do low LDL apheresis, but she would not start any treatment until after she had gone through puberty. Thankfully, I sought a second opinion, which is how my daughter became the patient of Dr. Sam Gidding when he was at Nemours in Wilmington, Delaware. He immediately started Avery on medications, and within 6 months, she had a port put in her chest and had started biweekly apheresis treatments. Fast forward a few more years, and last January of 2020, Avery had an open heart surgery to fix some congenital heart defect issues that were made worse by her homozygous FH. And during that surgery, the first surgery was okay. Things were okay for about 12 hours or so. In any case, Avery had some issues from the open heart surgery, and she was rushed into a cardiac cath, and then immediately into a second open heart surgery less than 24 hours after her first. It turns out at some point during this 24-hour period, she also suffered a heart attack. So my 11-year-old daughter had just gone through 2 open heart surgeries and a heart attack. Today, I'm happy to report that she's happy and relatively healthy, and by looking at her, you would never know that she has any health I'm hoping that there will be another webinar, and I would love to share more about Avery's health history and how that came to be. For now, I will turn it back to Sam, and I appreciate me being here today. Thank you.
Thank you so much, Michelle. I know how hard it is to present your story, and but it really also highlights what I found to be true and learned from your family is that a woman with heart disease who's contemplating pregnancy and has FH understands all the issues of FH the best, and can communicate all the key and important aspects of FH as a condition. I'd now like to ask Jeanine Roeters van Lennep to present to conclude the medical aspects of our webinar.
Well, my name is Jeanine Roeters van Lennep. I'm an internist vascular medicine working in the Erasmus Medical Center in the Netherlands. And there we have a FH expertise clinic, which I do not run alone, but also with the help of my dear nurses and research coordinators, Kim and Joy. And I know that they're also online. So hi to you all. And also with all my colleagues. Today I'm going to talk about women's issues of FH. And in general, as being a woman, you're lucky because, well, regarding cardiovascular disease, because in general, we get cardiovascular disease about 10 years later compared to men. Unless you have diabetes, unless you smoke as a woman, or if you have FH, because unfortunately, those are the three circumstances that you totally lose your female protection. For the rest, being a woman is also very interesting because, of course, we can have babies, but also we have a menstrual cycle, and there's also something like menopause. So what I want to do tonight is just go through this life cycle of a woman and also discuss the cholesterol issues of these. So first of all, and that's maybe also something to for the chat, who do you think have a higher LDL cholesterol? Are that boys or are that girls? And please feel free to put it in the chat what you think that the answer is to this question. Well, unfortunately, I can't really see it, but maybe Sam, can you tell me, like, what is the general opinion? Is it boys or girls? What do they answer? I can't really hear it.
I can step in here because we have it in English and in German, and it's split between boys, girls, and both. I think it's equally for each.
So no, yeah. Well, interestingly enough, let me go to my next slide. If that's it's the girls. It's both in FH and also in the general population. Without FH, it's that up till the age of 19 and later on in life, the men have higher cholesterol until women get menopause. But we don't know exactly why, but girls have a higher cholesterol compared to boys, and also in FH. But that's at a young age. And then in women, the menstrual cycle starts. And what's very interesting is that in general, always if a woman in her reproductive period, when the time between start of the menstruation and the menopause, when cholesterol levels are measured, I think that nobody ever asks you at which moment of your menstrual cycle did you have your cholesterol tested. Well, that's maybe a very strange question, but it's not, because well, we as women know how important the menstrual cycle is on your general health. It's related to migraine. It's related also to asthma attacks or to seizures. But what's also known, or at least less known, is that it affects cholesterol levels. And actually, together with Kirsten Holven from the University of Oslo, are now performing a meta-analysis, and it appears that there are more than 40 previous studies who already looked at the influence of the menstrual cycle on cholesterol levels. And here you can see on this picture the rise and fall of and this hormone, a female hormone called estrogen. So it increases at the beginning of the menstrual cycle. When a woman starts menstruating, it's low, and then when she has her ovulation, it's high, and then gradually it decreases again. And then you have another hormone, it's called progesterone. And at the beginning of the menstrual cycle, at the menstruation, it's low, and only in the second half of the menstrual cycle, it increases. And then, of course, it decreases again. And in general, and we are still looking at it, is what we found out is that the cholesterol levels are higher in the first half of the cycle when the hormone levels are low, and decrease when the hormones are increasing. But all these studies were performed in healthy women, and they have lower cholesterol levels. So what we're now doing, and that's very exciting because it's a study performed in the Netherlands, but also in Norway, is that we're looking at if this is already visible in women with low cholesterol levels, then maybe the fluctuations are even higher in women with FH. And so maybe in the future, it's not a strange question when your doctor is asking you, when did you have your cholesterol measured in the during the menstrual cycle? So then also a difference between men and women is, of course, pregnancy. And we already heard from the women with FH that, of course, it's a great period of your life to have children. But also it's very important to talk with your healthcare provider about medication, because about 3 months before conception, you should stop taking statins, ezetimibe, and also the new PCSK9 inhibitors. And well, there is not really solid evidence that it can affect your child and can cause malformations, but especially in pregnancy, people always want to be safe. And because there's also, just to be on the safe side, people say stop the statins. So you can't take these medications during pregnancy, but you can also not take them during breastfeeding. The only medications which are safe are resins. And resins are like really old-fashioned medications. That's what Steve mentioned, pre-statin period. But they stay in your intestines, so they won't come to the placenta and go to the child. The unfortunate thing about them is that they don't lower cholesterol very well. And also that's why they're replaced by statins. But also people can have more side effects because they're in the intestine, so they can give gastrointestinal side effects. Important to know is that women with FH do not have an increased risk of pregnancy complications such as premature delivery, or babies with a low birth weight, or congenital malformations, or, for example, hypertensive disorders of pregnancy such as preeclampsia or HELLP syndrome. And I said myocardial infarction with actually a question mark, because although we as physicians, it's not known to us that we don't know any women who had a myocardial infarction during pregnancy. I looked at the studies, And there are actually no studies at all who really assessed the risk of myocardial infarction in women with FH. But we assume it's safe to stop the statins and it doesn't increase the myocardial infarction. But actually, maybe you can help us out and gather the data. But I will talk about that really at the end of the webinar. And also important to know is that in some countries, such as in the Netherlands, if you know you have a FH mutation, it's possible to test the mutation in the cord blood right after your baby is born. So ask your healthcare physician about that. And if it's possible and you want to know, then what you get is that you get some test tubes, and just right before the cord is cut, then they, well, right after the cord is cut, they just gather some blood, and then immediately it's known if the child has a mutation or not. So also maybe important to know, and that's also that Steve said, you really don't have to feel guilty if your child has F8 because you can't help it. But maybe also good to know is that the lipid levels, if the child has inherited from you as a mother, are not higher than if the child has inherited the FH from the father. So it really doesn't matter. So if you take everything in woman's life regarding a pregnancy into account, then at a certain age, are the LDL levels here. You have high LDL levels, then you are diagnosed with FH and start statins. Then the cholesterol levels decrease. You have a wish to conceive, so then you stop the statins. You become pregnant, and even during pregnancy, it's good to know that the cholesterol levels increase about 30%. And that's just healthy, that's normal, because the child also needs cholesterol, and also your body is preparing for breast milk, and also therefore cholesterol is needed. So here it ends, but actually also during breastfeeding, the cholesterol levels stay high, and then after breastfeeding, then women can start statins again. And like Steve mentioned, the risk of cardiovascular disease in FH women is high, and is not lower compared to men, just like it is outside FH. And Steve already mentioned that maybe it also has to do with which statins physicians are prescribing. But also, if you look at this graph, there's quite a lot of time that, especially if you have more children, that women lose valuable statin years. So maybe also that is a reason why FH women lose their female protection. And then after you had the children and everything is okay, then menopause comes in. And menopause, the hot flashes, the night sweats are really inconvenient, but also you have the weight gain, the mood swings. And why it's important to mention to your healthcare provider if you are in the menopausal transition, it's because also the cholesterol levels increase during menopause. So that means that maybe for a very long time you're stable on statins, your cholesterol levels are always okay, and then suddenly your cholesterol levels are higher. And that's not because you're not taking the pills. That's just because you can't help it. It's the menopause kicking in. Also, what I hear frequently at my outpatient clinic is that women tolerate statins fine, they don't have any problems, and then during menopause they get mood swings, they have all kinds of symptoms that they can't really recognize, and sometimes they think it's the statins. But what I do is then just stop the statins for a short period, and then, well, sometimes we just find out it's not the statins, but it's just those complaints that are also associated with menopause. So very important I'm a doctor who always asks directly, like all women between 40 and 55, like, when are you, do you have menopausal symptoms? But sometimes doctors forget. So please be aware and mention it yourself. So there are major differences between men and women, but that is not only outside FH, but also for women with FH compared to men with FH. What's special about women is that they have a different life course with the menstrual cycle, with pregnancy, but also with menopause. And for a lot of different reasons, is it that women with FH seem to lose their female protection. So just also what Steve mentioned, that's very important. It's very important to start treatment for both boys and girls, but I think especially for girls, it's very important because of these reasons. So inform all women who you know, all your, if you're FH patients, inform all your daughters, your nieces, your cousins, your sisters, and get them diagnosed and treated in time. So this is what I would like to share with you. And also I'm happy to answer all the questions that may arise.
Okay, thank you so much, Jeanine, for highlighting the many issues that are special about women and have been under studied in the medical literature heretofore. We wanted to leave plenty of time for questions, so I've seen at least two. So I'll ask Steve the first one. I know he's answered it in the chat, but if you're a woman with FH taking your children to the doctor and you're interested in treatment, should those children be treated or not? So Steve, could you address that?
Yeah. One of the things about pediatricians, in fact, all doctors, is they are very concerned that a drug or a treatment that they're offering might cause more harm than benefit. And up until, I'll say, the last 10 years or so, there was a lot of reluctance, especially among pediatricians, to recommend that a child with FH should be on a statin, because they were just concerned about long-term benefits and long-term risks. And what we now know from, as data have accumulated, is that the risks for a child of taking a statin essentially are negligible, and the long-term benefits of taking a statin are very clear. You should, and I hope you can understand from what we've heard today from all the panelists, that taking a statin early, lower your cholesterol, especially if you're a woman, is going to be of long-term benefit, because as a woman, you will often have to not take a statin, as Jeanine showed in that very clear picture, whilst you're thinking of becoming pregnant and breastfeeding. Many women on average will have at least 2 or 3 years of their life when they can't take a statin, and that's part of the story about the cholesterol building up. So all the guidelines, European guidelines and American and all over the planet, say that children with FH should be considered for a statin by about the age of 10. Obviously, it depends how high their cholesterol is. And obviously, the higher it is, the more important it is that they should start a statin early. And the statins, as I said, have been tried and proven to be safe in children. So there's no need to be concerned about that.
Thank you. I have a couple of questions for Jeanine. One relates to statin side effects and statin mechanisms. Are there different mechanisms among the statins, or is there a reason why if you change your statin, you may not have side effects you're having on another statin?
Yes, indeed. That's a very good question. And on average, we see that if you change the statin, because of course they all should be different, because otherwise they should have only one name. So they're all slightly a bit different. And you have actually, we have two classes, and the main class, one of them is like water soluble and the other one is more like fat soluble. That's just, well, to explain it very simple. And rosuvastatin and fluvastatin and pravastatin, those are the water soluble ones, and simvastatin and atorvastatin are the fat soluble ones. So in general, if a patient has, or if a person with FH, you should say, has side effects on one of the statins, then I try to switch class and use the other ones. And also in general, side effects are also dose related. So some statins are more powerful than others. So if, for example, rosuvastatin and atorvastatin are the more potent statins, then sometimes I switch to, well, less potent statins, because at least it's better to have even like a less potent statin, but some statin and none at all. So it really, if you have side effects on one statin, please don't feel down and just ask your doctor to try another one.
Okay. There's one question on the risk of statins, taking statins until pregnancy becomes known.
Yeah, I know that in some countries they do it like that. But actually, most of the child is formed just at the beginning. So we don't know. The answer is we don't know if it's safe or not. It appears so, because if a woman for some reason hasn't stopped her statin in time, and she becomes pregnant, actually it's always okay. I don't have any patients who did have malformations in their child, but because we want to be on the safe side, and officially they have it's considered to be like not safe to do it. That's why we say, well, stop them before becoming pregnant.
Mhm.
Yeah,
Can I just say something here, because I have 3 kids, and all 3 kids, we didn't really plan the exact date, so I took the medication until I knew I was pregnant, and none of them have the FH, which is not related to the medication, but they're all fine, normal kids, so it's I already add up to a good
No, it's just that we have to follow the guidelines, and maybe
absolutely.
there's enough evidence, and maybe eventually it might be that the guidelines will change. But for now, that's how it is in the guidelines. But if you become pregnant with a statin, please don't feel afraid, and it's probably going to be fine.
Yeah, there are registry data which have looked at women who've been taking statins while they're pregnant, and they haven't shown any.
Exactly. Yeah.
So
That's
right
exactly
now,
right.
there's no data to suggest they're harmful. And if you go back to the original animal models on which the prohibitions are based, they actually were flawed in their conduct. So there's no, I wouldn't, as Jeanine says, if it happens, it happens, and we need to follow the guidelines. But the reality is there's no known risk. There was a question about fertility. Statins don't impact fertility. Well, we're coming to the end of our time. If there are any more unanswered questions, we'll try and answer them after the meeting and get back to you. I would like to remind everyone that the FH Europe website contains lots of information that can be helpful and can also help answer your questions about care for FH. Can we get up our questions for the group to answer? All right, First is, has this webinar met your expectations? So if you want to get onto that slido.com and let us know what you think. I'm seeing a lot of yeses, so we're all happy here as panelists. All right. We're getting a lot of great feedback here. All right. Why don't we move on to our last question? What other topics would you like us to address in 1 or 2 words? Some interest in homozygous and heterozygous FH. Okay. Well, I'd like to turn it over to Jeanine now to introduce the next webinar in the series, which will be sponsored by the European Atherosclerosis Society.
Yeah, that's, well, it's actually, it's not a webinar, but it's a survey that we're going to be running. It's collaboration between FH Europe, University of Oslo, Advisory Board of FH in Norway, and Erasmus MC. And well, maybe you noticed that a lot of issues that around pregnancy are still not solved in women with FH. So that's why we developed a survey to ask you, women who have FH, about what happened during your pregnancy. Were you told to stop the statins or not? How did it affect your choice of giving breastfeeding, and also for how long? We had a pilot in women from the Netherlands and Norway, but now we really need your help to run it out over the whole of Europe. And what we ask is that we need some women to review our survey and to see if all the questions are clear. And if you're interested to help us, then you will get a link, and maybe you can look over the questions and give us some feedback. Later on, you will receive a mail from FH Europe, also with some questions about feedback. And if you're interested, you can answer the mail, that mail. And then next slide, please. Yeah. And if we are finished and we have reviewed it, and then we invite everybody to join the survey. Next slide, please. And also, we had a previous webinar about cardiovascular disease more in general, and that webinar is now on YouTube. So if you're interested to know more, then please go to the YouTube channel of FH Europe. And then the next slide. And of course, this is all for you. So please share everything on social media via all these social media networks. And we will be very happy to do that. The next slide. Yeah. And lastly, there's also more, that's more for the healthcare professionals and the scientists. But of course, if you're interested patients, it's also open to you. There is an EAS webinar on the 5th of May about women, dyslipidemia and atherosclerosis. It's run by the EAS, so it's really going to dive in some deeper. It's also free, and please, if you're interested, you can register. I think that's about it. I would really thank the organization and FH Europe, because it was really wonderful and it was a lot of work to get everything going and running. So especially Magdalena, great, and you pulled it off again. That's amazing.